good morning, good afternoon, good evening po sa lahat. Welcome po to our 168th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community. And to all those who have just discovered us today, welcome po at sana po marami po kayong matutunan sa ating topic for today. I'm sure you're all wondering po, ano po ba itong cutting-edge healthcare facility natin, combining sports, wellness, state-of-the-art medical expertise na matatagpuan po sa New Clark City in Tarlac. Ito po tinatawag nilang PGH Sports and Wellness Medical Center or PGH Clark. It's been deemed a game changer in the realm of healthcare and fitness. So we would learn po today all about PGH Clark, how it's used to enhance well-being and performance of individuals from all walks of life. Hindi lang po sa mga medyo on the sporty side po, no? So this week po on our episode, we will be tackling how PGH Clark is not just a hospital, but also a holistic health destination, exploring its medical services, wellness programs, and advanced medical technologies, making it a true gem in the heart of Tarlac. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday date, and always looking forward po, no, during our Friday dates po, no. And today, we are honored and humbled po to have again my co-host for today's program, who is the Chief of the Division of Trophoblastic Diseases at the PGH Department of Obstetrics and Gynecology. She's also Clinical Associate Professor at the UP College of Medicine, Dr. Agnes Soriano Estrella. Dr. Agnes?
Hi, good afternoon, Dr. Raymond. Good afternoon to everyone. And hello to all of our participants here in the live broadcast of the Zoom webinar. And to all those watching via live streaming on the TV YouTube channel, as well as on the UP System Facebook page, the TV UP Facebook page, and the Stop COVID Deaths Facebook page. And of course, all those watching from the TV UP Signal TV channel 101. So our first main speaker is Dr. Robbie June Reyes, who serves as coordinator of the UPPGH Sports and Wellness Medical Center, and who is also affiliated with the UPPGH Department of Family and Community Medicine. We have a second speaker, and our second speaker is Dr. Lyndon Batan, who is the Chief of the Sports Medicine and Arthroscopy Service of the UPPGH Department of Orthopedics. And for our reactor today, we have no other than the Director of the UPPGH, Director Gap Legaspi, who will be giving his reaction. And finally, of course, the synthesis and closing remarks will be delivered by the head of the Office of Expanded Education and Training of the UPPGH, Dr. Stella Marie Jose. All right, so as you have seen on our opening billboard, we have transitioned to broader discussions on how the pandemic has affected health outcomes beyond the COVID-19. So yes, we have maintained the Stop COVID Deaths title, but have expanded our discussion. So we have expanded to various topics in medicine, which I hope will be of help to most of our listeners. And since you know that we would like to be abreast of the latest news in health and medicine here and abroad, we have a segment in the webinar called News Updates.
Thank you, Dr. Agnes, for our very first news update po, no? It's coming from the World Health Organization. They have outlined considerations for the regulation of artificial intelligence for health, releasing this new publication po last October 19, so kahapon lang po, no? It lists the key regulatory considerations on artificial intelligence for health, emphasizing the importance of establishing AI systems safety and effectiveness, rapidly making appropriate systems available to those who need them, and fostering dialogue among stakeholders, including developers, regulators, manufacturers, health workers, and patients po. Ito pong nasa publication na ito, they have focused on 6 areas of regulation for AI in health. So number 1, transparency and documentation. Number 2, risk management. Number 3, validating the data externally and its intended use. Number 4, data quality. Number 5, privacy and data protection. And then number 6, collaboration po between regulatory bodies, patients, healthcare professionals, industry, and government. So we understand very, very complex po itong mga AI systems, and they depend not only on the code that they are built in, but also on the data where they are trained on. So marami po talagang lumalabas po doon ng mga biases, and this could come from clinical settings, user interactions. So better regulation can help manage the risks of AI, amplifying those biases in the training data. So we'll keep an eye out for this one. How about you, Dr. Agnes?
Okay, so my news is something local but very important as well. So this is coming from the DOH. So last October 12, 2023, the Department of Health, in collaboration with the WHO, launched the 2024 to 2028 Philippine Council for Mental Health Strategic Framework, which would guide the development and implementation of mental health policies, programs, and services to address the significant burden of mental illness and improve mental health and well-being in the country. So we all know that mental health and mental illness is, well, medyo nagiging problema na po siya, no? Dami pong affected people, especially after the pandemic. And so various government agencies and key stakeholders actually work together in formulating this 5-year strategic plan, which aims to reduce premature mortality, prevent and treat substance abuse effectively, and reduce the vulnerability of individuals and communities to mental, neurological, and substance use disorders. So the event also featured the expansion of the PhilHealth Mental Health Benefit Package. I did not even know na merong ganitong package ang PhilHealth. So I think this is good news to everybody because this package given by the PhilHealth will provide mental health benefits for outpatient services. So the primary care package includes 12 consultations, diagnostic follow-up, psychoeducation, and psychosocial support provided by mental health outpatient facilities for medicine access sites. So I think that's very good news, something new. I learned from this news also. So that's the latest news update from Stop COVID Deaths.
Okay, thank you so much, Dr. Agnes. Tuloy-tuloy lang po tayo. And with that, we'll really be honing in. Ano po ba itong PGH Clark na pinag-uusapan natin? It's really located at the heart of Tarlac po. No? But before that, we'll introduce po muna ang ating person on the street video, just taking the pulse of the common folks on the street to set our discussion into context. And this video, very, very short video produced po week in and week out by our very hardworking and dedicated po na TVUP team. The questions that we pose are as follows. Narinig mo na ba na may PGH sa New Clark City sa Tarlac? Narinig mo na ba ito nung huling ginanap dito ang Asian Games? Nakabisita na po ba kayo doon? At kung oo, ano-anong mga serbisyo ang alam mong ino-offer sa PGH Clark? Sa personal mo bang karanasan, ikaw ba ay nagkaroon na rin ng injury dahil sa sports at ano-ano ang iyong ginawa? At sa tingin nyo, ano ang maaasahang serbisyo na available sa PGH Clark? Please watch this.
Well, first of all, I actually did not know that there was a new PGH in New Clark.
Yes po, narinig ko na po na merong PGH nga sa New Clark City sa Tarlac.
No, I've never heard of PGH in New Clark City in Tarlac.
Actually, yung last balita ko is plan pa lang siya. So, right now, hindi ako sobrang aware if meron na talaga siyang physical building doon. Pero alam ko na merong plano nga na magkaroon ng PGH sa New Clark City, sa Tarlac.
I didn't know the Asian Games were held near there either.
I didn't know na it was in the Asian Games or this was from the Asian Games.
Hindi rin ako masyadong aware doon na doon nagkaroon ng Asian Games?
So, no, I haven't visited.
Hindi pa ako nakakabisita sa PGH Clark, pero gusto ko sanang mapuntahan.
As for my time as an athlete, I used to be a cheerleader back in high school. And when I started, I actually was quite unfit, so I was quite prone to injury. My worst one being I tore my calf, which put me out of commission for about 2 weeks.
Well, na-injure na ako, pero hindi siya yung to the point na kailangan kong masugod sa hospital. More of mga minor injuries lang siya, like nagkaroon ako ng sprain sa ankle or sa knees ko, medyo na parang na-stretch siya before.
I do have experience getting injured. I've had some knee problems and ankle problems. I used to play as a center, so when you're tall, usually yung issues more always on the knees and the ankles.
Since then, I've been trying to keep myself active, so I currently work out. Like I go to the gym, I run occasionally. It's just ever since I became an athlete in high school, I wanted to keep up that somewhat active lifestyle.
Mostly, parehas lang nung service na binibigay nila sa PGH main sa Manila. I believe na okay naman and ginagawa naman nilang lahat yung best nila para maka-accommodate sa lahat ng tao na nangangailangan ng tulong.
If I could suggest anything I would like the PGH to kind of focus on would be either, if it's possible, like surgeries for athletes, although that might be very difficult because of the doctors' availability. So something that would be really nice is physical therapy for the athletes.
As for, let's say, PGH services that I would have liked to see, or would like to see actually, is a lot of, well, maybe PT access or consultations. Because I think me personally, as a former athlete and as someone who tries to stay active, the number one thing I would like to see, or that I would like whenever I would get injured, is consult to ask, like, how severe is it, or what caused this, or maybe most importantly for me at least is how can I recover as quickly as possible.
And in-expect ko na sa PGH Clark, which is mas bago yung mga equipments doon. So, hopefully, better yung facilities din and better service na rin since siguro mas advanced and high-tech na yung mapupunta doon na mga equipment or mga kagamitan.
That on top of the general treatment, because to be treated for an injury is, needed obviously, but like I would very much like to know, the rest. Like, how can I continue to speed up this recovery? How can I prevent it in the future?
Okay,
Okay,
so
thank you so much. What do you think about that, Dr. Agnes?
Just like them, I think most of our listeners don't really know about the existence of this great facility in the New Clark Interlock. So I think this is going to be a great webinar. And kasi alam mo, puro athletes yung nandun yung in-interview. Pero I think hindi lang naman pang-athletes. Correct me.
That's
Hindi
true.
lang pang-athletes. So I think this one is a very relevant topic because meron tayong option. No? Meron tayong options na pupuntahan na magandang facility in the Central Luzon area.
Okay. Thank you so much, Dr. Agnes, and really thank you also to our TVUP team for coming up with all of these interesting po ng mga POTS videos po, no? And just letting us know what people on the ground are thinking. Just a little bit of housekeeping for all those who are asking. Certificates of attendance, we have already sent out po up until last week's webinar, 167th webinar. And we will continue to give out those certificates to those who have watched at least 50% of the webinar duration po. If you feel you should have received but did not, please email us at stopcoviddeaths@up.edu.ph. For our webinar today, we'll be having our standard panel discussion format, and after our speakers have presented, that will be followed by a Q&A session. But before that, meron lang po tayong very quick po na fun quiz, which will be introduced po through a cute and short video.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Chusi, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Okay, thank you so much, TVUP, and good afternoon po sa mga papasok pa rin po sa ating webinar for today. Can we have on the screen po, both in Zoom and in Slido? There we go. Sige lang po. Dito rin po sa Zoom. For those who are joining us outside of the Zoom, you can also still join us dito po sa ating fun quiz by opening up your browsers, typing in slido.com doon po sa inyong browser sa address bar and entering the code 6510096 when you are prompted. That's 6510096 for you to be able to participate in our fun quiz. We have two questions for today. The very first question, what is the most common sports injury po? Is it A, ankle sprain, B, tennis elbow, C, leg fracture, or D, ligamental tear? Yung po mga ACL, MCL, PCL po. No? So we'd like to greet those who are joining us from the Orani District Hospital in Orani, Bataan, from New Sinai School and College City of Santa Rosa in Laguna, from Iloilo City Local Government Unit, Cebu Provincial Hospital in Carcar City, Cebu, from St. Elizabeth Hospital in General Santos in South Cotabato. Meron din po tayong manonood, supporters and viewers po, no, from La Consolacion University in Malolos, Bulacan, from Bulacan Medical Center, Department of Pathology and Laboratory Medicine po. Meron din po from NAS Student Support Services, from UP Los Baños, from UP Health Service po sa Diliman, from the Philippine General Hospital. So maraming salamat po. For question number 2 reads, what services are included in primary care? Is it A, vaccination, B, normal delivery, C, giving prescription, or D po, referral to the specialist? So I'd like to greet those joining us from the University of Haiel in Haiel, Kingdom of Saudi Arabia. Thank you so much. From Chonin Hospital in Taipei City in Taiwan, Lunichi Ali University of Blida 2 in Blida, Algeria, from Los Angeles, California in the United States, of Canadian Medical Center in Dammam, Saudi Arabia. Meron din po pala tayong nanonood din po, no? From locally, Philippine Academy of Family Physicians in Angeles City, Pampanga, Mindoro Occidental Medical Mission Group in San Jose, Occidental Mindoro, West Visayas State University Medical Center in Iloilo City, Capiz Emmanuel Hospital, Rojas City in Capiz, and Ateneo de Zamboanga University, Zamboanga City, Zamboanga del Sur, Soc Sargent General Hospital in Surala, South Cotabato po. There's also one internationally, Island Hospital Penang in Penang, Malaysia, and then St. Elizabeth Hospital General Santos in South Cotabato. Okay, so without further ado, I'll turn the floor over to Dr. Agnes, who will introduce our very first presenter for today.
Okay, so I know that everyone is excited to get on with the webinar, and let me now introduce our first main presenter. He is the coordinator for the UPPGH Sports and Wellness Medical Center. Please all welcome Dr. Robbie June Reyes. The floor is yours.
Hi, good afternoon, everyone. Thank you, Dr. Agnes, for that very warm welcome. So let me just share my screen. So there. So I'm very excited to present to everyone our UPPGH Sports and Wellness Medical Center, which is located in New Clark City, Tarlac. So for the outline of this presentation, we'll be going into the background of this project, including the proposed plan, the framework, the mission and vision, the core services that we will be offering, including other services, and the updates on this project. So for the background, in February of 20 to 2018, the University of the Philippines, together with NGAC Phase 1 joint venture, which is a joint partnership between BCDA and MTD Clark, entered into this memorandum of agreement to operate and manage the Philippine General Hospital satellite for sports, medicine, and wellness. At this time, with the MOA, there are three phases that were mentioned. We have the phase one, the phase two, and the phase three. For the phase one, we have the Olympic Village Polyclinic, which we saw during the Southeast Asian Games. No, eventually, we're planning for this to be a 30-bed hospital, eventually becoming a 200-bed hospital. Now, this facility is located from PGH staff 2 hours away. And then internally within the New Clark City, we are located near important buildings and structures within New Clark City. No? We have the National Government Administration Center, and we're also near to several sports facilities within NCC. We have the New Clark City Aquatic Center, the warm-up track, and then the New Clark City Athletic Stadium. Now, apart from that, there are several key development in New Clark City, including the nearby areas. One of which is establishing a satellite office for the Office of the President in the NCC. We are also anticipating the entry of the Philippine Sports Agency. We also have the National Sports Academy there already operating. And we have also regional offices of the NBI and the Supreme Court, including the Bangko Sentral of the Filipinas. Other institutions within this NCC would be, apart from PGH itself, a new branch of UP. We also have another branch of NIH, as well as the Philippine Science High School and the Technological University of the Philippines. We also expect to have a Virology Science and Technology Institute under the DOST, as well as an agro-industrial hub and national seed technology park under the Department of Agriculture. We also have several important structures nearby. We have the Clark International Airport, which has a direct entry to us about 20 minutes away. We also have the Medical City in Clark, Pampanga, and the OFW Hospital in Pampanga as well, which is just 1 hour away from the clinic. And we would also expect to see the opening of the North-South Commuter Railway Extension Project, which connects us here in Metro Manila from Tutuban to New Clark City. Now, currently, there are several things already happening inside, no? So mostly, apart from the duathlons, triathlons, as well as the swimming competitions inside, there are several developments through the BCDA that we see that are ongoing, no? We have the smart transport system under Japan, and you also have the low carbon district cooling technology. Now, apart from that, you'll see on your right side would be the construction of the UP New Clark City, which started around December of last year. Now, for the proposed plan, after going through the resources available within the community, as well as looking at the opportunities for growth, this is what we saw. No? So for phase one, apart from being an Olympic polyclinic, we would also be looking into creating and being accredited as a PhilHealth Consulta facility, eventually becoming a primary care facility, and then progressing into an infirmary hospital, and eventually a level 3 multi-specialty hospital. So apart from the initial clients that were identified, which include the residents of NCC, we would also be extending our clients dun sa mga sports students and athletes natin, including the government employees, and the overflow of PGH and OFW hospital patients, as well as the nearby hospitals then within the area. Now, PGH Clark is part of a bigger plan in New Clark City with the theme of a green, disaster resilient, and smart city that is distinctly Filipino and globally competitive. With this vision, The UP has this vision of becoming a smart, healthy city within 2065, which involves a network of advanced medical treatment centers, which include but are not limited to cancer, cardiac care, and geriatrics. Also, a health technology and innovation center, which include but is not limited to preventive medicine, artificial intelligence, genomics, biomedical devices, and a clinical trial center. We would also expect to see some health educational facilities as well as a disaster medical center. Now, this is part of a bigger plan in PGH and the UP system. We see a lot of developments within PGH. No, this is our way of expanding our services outside Metro Manila to be able to reach more Filipinos. No, so apart from PGH Clark, we would also expect to see PGH Diliman. We also have an ongoing construction for PGH Mindanao, as well as a as well as a cancer institute. No, for PGH then. Now, in terms of the framework, these are the guiding principles that we had in mind when we were formulating the plan for this hospital. Recognizing the importance of universal healthcare and primary healthcare, these are our primary foundations in thinking about the operations of this hospital. And recognizing that we are part of a greater health system, we also need to recognize the importance of the other important determinants of health that would also affect our health system, no? Which would include your structural and intermediary determinants. Now, this is a very, very busy slide, admittedly. Now, if you look here from that very busy slide, our goal then is to be the gatekeeper and to be the navigator of this very complex system. So you see the star here, we're at the center who would help the patient in navigating and connecting the different health facilities around from a primary care provider network going into a healthcare provider network, eventually connecting this to the Apex Hospital. Now, for our mission and vision, looking back at the mission and vision of UP Manila, the PGH, and the College of Medicine, we try to be in tune with this, and we try to be in line with the service, education, and research parts of our institution. No? So for our vision is to become a role model for establishing a network primary care center of excellence under UHC by 2025, as well as an internationally recognized center of excellence in sports medicine in Southeast Asia by 2026, with the mission to provide a comprehensive, integrated, and coordinated set of quality, cost-effective, compassionate, and accessible sports medicine and wellness services utilizing the patient-centered, family-focused, and community-oriented care approach to the athletes, government employees, and residents of NCC, including the neighboring towns, provinces, and regions. Now, there are several key focus areas that we would like to look into. One is community-oriented primary care, meaning it's important for us to involve the community when we plan our services. Apart from that, also looking into the practice management and health administration, the quality assurance, research, and health legislation, meaning the processes that we will be doing in the hospital. There is always that at the back of my mind, that at the back of our minds, the need to improve, the need to provide standards, which would then be translated into research that would then serve as an avenue for us to create legislation as well as to create part of the issues and advocacies that we would want to provide for our Filipino people. No? Now, apart from this, we would also want to integrate the information technology. No, we can no longer deny that digital health is already part of our system. So we need to integrate this in our services. Now let's go to the meat of the presentation, which would be the core services. No? Now, reviewing again the different phases, we further subdivided our plan into phase 1A, 1B, and 1C. So for phase 1A, which is for October 2023, our schedule of operations would be from 8 a.m. to 12 Wednesdays, and then 8 a.m. to 5 p.m. on Thursdays and Fridays. So this is just 2.5 days. This is just part of our soft opening, but we would be focusing on medical consultations for non-urgent primary care cases. We already have our staff identified for this phase now. And then we will be utilizing what we're using right now at PGH, which would be our OKRA system. And then apart from that, in terms of our patient, we expect this to be coming from our LGU. We would also be accommodating walk-in patients. And for now, we also have our National Academy of Sports and other offices within NCC as our primary clients. No? So in terms of transportation, we expect our patients to be coming in through ambulance conduction from our LGU that would be coordinated. No? And then we also talk already with the Mayor of Capas Tarlac to provide additional transportation for our patients. Now, part of what we will be utilizing is also PhilHealth, no? Apart from the Radish that we have here in PGH, which for now, if you go through our Radish, we already have a dedicated tab for UP-PGH New Clark City. So our estimated patients for our operations for now, if we're going to have at least 2 doctors, there would be 40 to 50 patients per day with an expected patient load of around 1,800 to 2,250 patients up until the end of the year. But again, for now, we would be focusing on the non-urgent primary care cases, including chronic and acute care, and occupational health and school health. No? Now, in terms of the referral, recognizing that our services is not yet complete at this time, we are forming MOAs with the nearby hospitals and other facilities. No? Right now, we have a MOA that is under review with Tarlac Provincial Hospital with the target signing by December 2023 to provide access to patients that would be needing higher care. Now for phase 1B, which is January 2024, we would expect to go on full operations already. And these are the services that we would expect by that time. We have preventive screening services, as well as laboratory services, radiologic services, as well as pharmacy services. Now, this is two-pronged, no? So we have a MOA with Tarlac Provincial Hospital. But apart from this, we are also working on providing our own services from within PGH. Now, these are the list of the services that will be available. Now, this is under PhilHealth Consulta, which was mentioned during dun sa news natin. No? So these services are provided for free as long as they fall within this list of laboratory, radiologic, and ECG services, which also includes medications. As long as the medications that are prescribed are within this list, this would be provided for free. Now for phase 1C, medyo mas mag-upgrade na tayo, no? This time, this would already be a primary care facility. So we would be extending our services apart from the radiology, laboratory, and pharmacy to include the ambulance type 1, the dental, and the birthing services. Now for this is more specific na, no? So we would have a sports and exercise medicine arm as well as a primary healthcare arm. For the exercise and sports medicine arm, there are several services that we want to provide, which would include the exercise and sports injury screening and prevention, also exercise and sports-related injuries management. This would also include strength and conditioning, also physiotherapy and rehabilitation. Extending further, we would also want to provide sports psychology, sports dietetics, as well as sports science services. More specifically, for injury management, we will be providing exercise testing and prescription, as well as diagnostic MRI and ultrasound, as well as ESWT. We would also be providing medications to reduce pain, as well as injections, which would include steroids, PRP, and viscous supplementation, as well as minimally invasive surgeries and open surgery once we have the equipment. Now, in terms of primary care, we expect to deliver a spectrum of care from womb to tomb, from pediatric to geriatric, also extending to other areas of care that are important, which would include preventive health and wellness, occupational health, school health, as well as chronic home care and care coordination, as well as hospice and palliative care. We would also be able to provide minor surgery in primary care, as well as primary care, ENT, and primary care mental health. So our focus would really be preventive health and wellness, which encompasses all these different areas. No? So why is it important? So the importance of this is trying to drill down with the basic everyday things that we are doing, which would include sleep, nutrition, and physical activity. Because over time, all these habits and activities that we are doing would have an effect on our health. So it's important for us to focus on these areas. Now, apart from that, with our expansion, we expect to provide a primary healthcare service Mondays to Fridays, 8 to 5. And we also would want to provide urgent care wherein there would already be 24/7 services extending to the community, which would include your school health and occupational health. But of course, not forgetting that there will still be patients that we need to refer. Thus, for inpatient care, especially for those needing secondary and tertiary care, we would also be creating MOAs with our nearby hospitals, which would include your hospital Ning Capas, the Capas Medical Center, the Tarlac Provincial Hospital, and the Central Luzon Doctors Hospital. Now for this, taking into consideration also our role in education, we are planning to introduce a primary healthcare rotation for our residents, eventually also for our interns and clerks. Now, looking at that picture and going back to our plan, with us being a primary care facility, we would now be able to connect all the different facilities around us, which would include your health station, as well as our freestanding services, no, to our level 1 and level 2 hospitals, as well as our level 3 hospitals, and when needed, also connecting to our Apex Hospital, which is PGH. No? Now, apart from that, from the services that we mentioned before, we would also expect to expand further our radiology services to level 2, also including ultrasound and MRI at this time. Also, we would be expecting an expansion of our laboratory services provided. And then again, as mentioned, we would already have an ambulance type 1, dental and birthing services that would be outsourced. Now, the other services that will be offered that would be very exciting and we're quite looking forward to would be lifestyle medicine, LGBTQI health, the orphan diseases, traditional medicine, military medicine, international health, and One Health. For lifestyle medicine, so this is something that the department has already been working on, and we plan to introduce this by next year. And then we plan to also introduce it in PGH Clark. For LGBTQI health, this is something that we recognize that they have unique needs, as well as the importance of addressing the cases of HIV in the Philippines, which is fast rising. No? So we need dedicated services for this. And also not forgetting our orphan diseases. No? So we do have an RA, which provides for services for this specific, for orphan diseases. But then we need a stronger and a well-formed service that would provide better coordination of this care. And then we also want to provide traditional medicine. No? This is already present in our health menu right now. We already have PITAC, but our role is to be able to connect all of this different institutions to provide coordinated service for our patients, also incorporating Oriental medicine. So the Filipino-Chinese community is a very important part of our culture, and they have a lot to offer in terms of medicine. So it's not just traditional medicine, but it's really Asian medicine, complementary to Western medicine. Also, we expect to have military medicine. So we have a camp there located in Tarlac, which is the Camp General Sorpiliana Aquino. And then we expect expansion also for this one. So we expect also clients coming from our military service, and also international health, taking into consideration that we're very near Clark International Airport and we're mainly the gateway, the entry place for our international clients. It's important for us to provide the services, especially recognizing the effects of the recent pandemics that we had in the country, from the COVID down to the flu, in Hong Kong, also the MERS-CoV. We would want to provide closer services to our patients then, and eventually providing One Health. No, there is so much to be tapped on in the UP system. No, there are so many expertise that we have. And we recognize that health is not just limited to that. It also involves a lot of these other factors, which include your animal health and environmental health. Similar to the IATF that we had before for COVID, we want to establish this network of specialists to be able to provide plans if in case we do encounter those problems again in the future. Now, apart from this, for the phase 3, when there's already expansion to a 200-bed hospital, we expect, again, as mentioned before, this network of advanced medical treatment centers, the Health Technology and Innovation Center, the Health Educational Facilities, and a Disaster Medical Center. Now for the updates. So we visited the site last July 2022 with our director, Director Gap Legaspi, as well as Dr. Leo Cobilan and other representatives from DCDA. We've also met already with Governor Susan Yap, and she's very supportive of our plans for PGH Clark. We've also visited our extension campus in Tarlac, as well as the Tarlac Provincial Hospital. And we've also visited and also talked with Mayor Attorney Rosela Rodriguez of Capas Tarlac for our plans in NCC. Now, I'd like to take this opportunity to thank the other institutions within and outside of PGH who have been very generous with their time in terms of collaborating with this project, the Tarlac LGU, the Capas LGU, the Tarlac Provincial Hospitals, the BCDA, including the different departments within PGH, our Department of Orthopedics, Rehabilitation Medicine, our Department of Laboratories, Radiology, as well as the Division of Cardiovascular Medicine, the Central ECD Station, as well as our Pharmacy Department, and also various administrative services within PGH, our Information Technology Center for providing support for our information technology connectivity within PGH Clark, also the legal office, our nursing department, dietary department, ENT, sleep medicine, dental medicine, chaplaincy, and other administrative offices. We have also extended our collaboration outside of outside UP-PGH within the UP system, the UP College of Public Health, the Nutrition Department, as well as the UP College of Engineering, Electrical and Electronics Engineering Institute. Also, specifically Dr. Michael Tan and Dr. Gijan Lasco for providing guidance regarding our services for indigenous health. Also, our other external partners, which would include the National Academy of Sports, the DOH Health Facilities and Services Regulatory Bureau, the Disease Prevention and Control Bureau, the GSIS, and the Holy Angel Center for Kapampangan Studies. Now, there was this one time that I was standing right at the back of the director's office, and I saw this picture. So PGH has been there since 1907. We've gone through numerous different events in the past, from the war down to the COVID, and yet here we are still standing strong. And with that, there's that recognition that we have an important role in establishing that connection between the different institutions, because health is something that is multidisciplinary. It's also affected by the different determinants around us. So our role is to be able to define those connections and make it visible for our patients. And finally, I'd like to take this opportunity to invite everyone. For those that were not mentioned, we would like to invite you as well to collaborate with us to make innovations to become a transformative healthcare in the future for the Filipino people and with the Filipino people. So with that, thank you for this time to present PGH Clark, and we're inviting everyone and to collaborate, and we're opening soon. Thank you.
Wow, okay. Thank you so much, Dr. Robbie. So, aabangan po natin yan, and something that a lot of people, obviously, especially nandun sa may Central Luzon area, will be really keeping an eye out for. So, hope you'll stay, and we'll talk to you with questions later on, Dr. Robbie. Okay? All right. So so just to remind everyone, for today's Q&A session, we'll be choosing from a slew of questions that will be sent out. We encourage everyone to start typing in your questions in the Zoom Q&A or in the comment section of the Stop COVID Deaths or TVUP Facebook pages, or sa comment section po ng TVUP YouTube channel. Next up is our second main presenter. He's the Chief of the Sports Medicine and Arthroscopy Service at the UP-PGH Department of Orthopedics. Please give a warm virtual welcome to Dr. Lyndon Batan. Dr. Lyndon?
Good afternoon.
Good afternoon, sir. Go
Thank
ahead,
you
sir.
for the invite. Okay, can I share my screen?
Yes, sir. Go ahead.
Good afternoon. I'm here to talk about the experience of the sports medicine and arthroscopy service with the UPPGH satellite for sports medicine and wellness. So from the get-go, I think from the conception of the new Clark City, which will house, which is a smart and disaster resilient community where they will house the secondary government or the satellite government when disaster struck Manila. No? They already envisioned that the UPPGH would be part of that city. And if you can see in this layout, aside from the main administrative building, which is on the right, if you can see my pointer, UPPGH is right beside it. It is also near the entrance. No, if you can see, the big oval is the stadium. This is the practice oval, and this on the right are the hotels and dorms that will be housing the sports athletes and the students of the NAS, no? And also the aquatic center. So from the get-go, they already envisioned that PGH will be there. And because the National Academy of Sports will be there, and they envisioned that because of the world-class sports facility, they wanted the PGH hospitals will be for sports medicine and wellness, and sports medicine as part of the main department of the polyclinic. No. So they, Dr. Legaspi tapped the sports medicine and arthroscopy service of the UPPGH Department of Orthopedics. No? We have been one of the leading trainees of orthopedic surgeons in the country for over the past 58 years, 55 years, sorry, 52 years, sorry. These are the consultants, and we have produced probably the one of the 7 of the top 10 sports surgeons in the country, including one of our alumni, Dr. Iggy Agbayani, who passed away. May he rest in peace and may eternal light shine on him. The sports medicine and arthroscopy service provides cutting edge technology to our less fortunate brothers or countrymen, which sustain sports injuries. We were provided by the hospital with cutting edge technology, including in this picture the store's one operating room where they house the latest arthroscopy and bed for endoscopic and arthroscopic services. We also provide training, of course, to our future sports surgeons. This is a picture of our last cadaver workshop done just a month ago in the Department of Anatomy, where we taught our trainees and also the trainees of the whole of other institutions. We also, as service, provide coverage, including Nesty Beach Volleyball, UAAP, and NCAA coverage for sports. And because our director is an athlete in UP Maroons, he with Dr. Michael Tan and Dr. Edward Warang, our chair at that time, wanted to help the UP Maroons during around 2018, I think was the year. And they asked the department if we can help the UP Maroons at that time. So after much conceptualization, we had 2 postgraduate courses including the UP athletes, where we taught them sports injuries and how to tape ankle or simple injuries, to treat simple injuries. We were given full support by the dean, by the chancellor, by the department head, and Dr. Gaspi. So as a continuation, we did the first pre-participation screening of our UAAP athletes, 600 of them during one semester in 2019. No? But it was supposed to be a yearly thing, but it was stopped because of COVID, and we just resumed it this year. Last August, we did a pre-participation also of the UP Maroon athletes. The first semester, no, we'll be having another one this November for the second semester events. No? We also used the data that we have collected for our research, for our continuing education for our trainees, no? And of course of the sports medicine and arthroscopy science. But there was a problem, as noted before. The surgeries of sports medicine and arthroscopy are not cheap, no? So we have Dr. Legaspi and again the same players envisioned that the UP should shoulder the treatment of our elite athletes in UP Maroons. Hence, they came up with a university varsity wellness program where we provide all treatment services to our athletes almost free of charge using PhilHealth, GSIS insurance, and UP system funding. No? So up to this, from 2018 to this day, we have given treatment to almost all the athletes at that time. I think we did already around 70 to 80 surgeries for our UP Maroons, and we have treated all the athletes during our weekly clinic in the UP Varsity Training Center currently, where we see 20 patients weekly and treat all those patients. We also give rehabilitation medicine treatment. No, all this are in with the help of our partners, the Department of Rehab Medicine in UPPGH, and also the College of Allied Medical Practices, no, camp in UP Manila. So going back to the PGH Polyclinic, it was fast track because of it will be used for the 30th SEA Games. So PSC, in coordination with the Philippine Sports Commission and of course the BCDA, they tapped PGH to man the Polyclinic for the SEA Games. No? So because of we brought in equipment. We bought new equipment, X-rays, beds, sterilizing machines, ultrasound, to treat the staff and the athletes that will be coming to the center. At that time, we brought in the splints, the medical needs of the patients. At that time, because this was a national event, no, they were also tapping the LGUs, the PMA, to man all the events in different locations in Luzon. For our part, in ortho and rehab medicine, we tapped our alumni in the area, which is Tarlac, and asked them to go on duty with us during the SEA Games, I think 2 weeks, at that time. So as you can see in these pictures, we have the rehab medicine and all the staff of the UPPGH, where we transported everybody there for I think 2 weeks, I think, during the SEA Games. So the PSC also visited the center, and I think they they approved of the services because most of their doctors will be in the field and they can have their athletes treated at the center while they're resting at the Clark New City. So if there will be a phase 1A for our polyclinic, I think because of the pandemic, we already started teleconsult. I think the department and sports medicine can provide teleconsult for those who will be manning polyclinic. Also, we can provide splinting and first aid treatment training for those who will man the polyclinic. But at level of 1C, where they can already do surgeries at the polyclinic, maybe we can we can already do arthroscopic surgery at that time, because we have been doing that for the past few years in the department. No? So I think if ever at 1C, we can already start surgeries there. And because of the facilities, where the facility is geared for athletes, it's a big rehabilitation facility where we can already treat patients treated with surgeries to do rehab in the center. So again, currently the plan would be to tap, of course, the orthopedic alumni at the center. But in the long run, we hope to have a fellow who will also help man the center for sports injuries in the future. I was saddened that nobody knows about our services in PGF, sports medicine and arthroscopy services. No? So this is our web page. This is our Facebook page. Anybody with sports injuries can contact the page and can set up a meeting with us. This few years has been very exciting because during the past few years, we already had the consignment basis. So all the injured athletes or everyday people doing surgeries do not have to pay already for their implants because it's free in UPPGH. You just have to contact us and set an appointment. And thank you very much.
Okay,
Okay, thank you so much, Dr. Lindon. Wag kayong malungkot, Dr. Lindon. Papalaganapin natin ang mga makakaalam ng inyong mga serbisyo. Thank you so much. Dr. Agnes, go ahead, ma'am.
Madaming makakaalam. Actually, madami nang may alam, Lindon. You're gonna be a busy man. And I am amazed. Ang ganda-ganda ng center. I want to visit that center. Ang lapit lang niya, no? Ang ganda niya. And I think it's such a state-of-the-art, something that we can be proud of. And now I can see that PGH is truly a very, very busy hospital. May PGH OFW that we had a webinar on. Tapos meron ito, aside from the PGH in Manila, and then the plans for PGH Diliman. So we are really extending our arms to all of our kababayan. So we go to our first question. Okay na ba yun, Doc Raymond?
We'll need to, I'm trying to scan po if we have Director Gap. Looks like he is still not not available. I'll still check dito po kung baka nandun po siya sa ating mga attendees because I am not seeing him. I just wanted to double check. Baka lang nandito si Sir Taos, di natin siya matawag if ever. Okay po. So before we start the Q&A session lang po, Dr. Agnes, we'll just have a very, very quick break for our special public service announcement for today.
Okay.
Aloy, bilisan mo! Dali!
Wala! Ha? Ano nangyari? Ba't hindi kita makapitan?
Handa ka na ba, Kaloy?
Oo naman, ate. Nabakulahan na kami. May powers na kami laban sa inyo.
At hindi nyo na kami basta-bastang makakapitan. Yay!
Sisiw!
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP, the COVID Communication Public Service Announcement. Just one of the many creative outputs of the Stop COVID Deaths team to push for COVID-19 vaccination. So please share this video clip with all your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. Okay, we can start the ball rolling. Dr. Agnes, go ahead
So we
with the
can
first
probably
question.
let's ask our speakers to please turn on their videos, and we can have our first question. I think the first question is similar to the question for the PGH OFW Center. Madaming naiinggit kasi for Visayas and Mindanao. So, may plans ba to extend, at least in the future? Nakita ko kasi 65 years. Kailan nga matatapos to? 2065. There's a 2065 yung plans. But in that, until 2065, are there plans to extend our reach to the Visayas and Mindanao area?
In my personal opinion, it's important for us to look first at the available resources within the community and also to look at the opportunities available. So if there's a need for us to expand further, then definitely that would be one of our focus, no? Specific for PGH Clark, the reason why we have it there is because it's within the NCC na facilities natin, yung sa sports, no? So definitely there is a need for us to provide that services. In terms of extending it further, the way I see it, the other services that we could provide can be the conservative primary care sports medicine. Now, if there's an access or there's available equipment for them to also do possibly surgeries, then we could also explore those options. No, but I guess the more realistic that we could do at this time would be the primary care conservative measures for sports medicine for our other areas in the Philippines.
Are you doing this in collaboration with the sports medicine? Kasi alam mo, subspecialty pa yung sports medicine in the Department of Orthopedics. So Lyndon, are they doing this in collaboration with you or with the Philippine Orthopedic Association?
I think with for the UPPGH, kami muna ata ma'am yung magiging collaboration with them. No? But regarding po sa the facilities, I think in my part with the experience with the UP Varsity Wellness Program, let's stay muna with the UP system. I think it was a presidential administrative order, no, that tells UPPGH to provide the services to the UP athletes. It can further be expanded with, of course, with other state universities in Luzon, Visayas, and Mindanao, no, with with another administrative order. But right now, it's just a pilot. Currently, it's just for the Maroons in UP Diliman, but hopefully, it will expand as far as it can reach to all the state universities. So far, I think the UPPGH naman, ma'am, depends on where we will be going after the Luzon area. Kung mismong PGH, but the funding for the UP athlete most probably can be done already in those areas even without PGH. Important lang is that the UP system provides the funding for their treatment.
Okay.
Thank you so much, Dr. Robbie and Dr. Lyndon. We just saw Director Gap Legaspi come in. Sir, are you ready with your reaction, sir? No problem, sir. Go ahead po.
I don't even know what I'm reacting to, but I have four simultaneous things going. There's a workshop. Anyway.
Yes, sir.
Good afternoon, everyone. I guess you've heard about the grand plans in the first true extension of the Philippine General Hospital, which is the UPPGH New Clark City Sports Wellness Medical Center. No? This started out as mentioned earlier, as a partnership between BCDA and UP Manila and PGH, wherein vast hectares of property within BCDA will be dedicated to academic institutions and academic hospitals. So this is an offshoot of the efforts of our Chancellor Menchit Padilla, and of course PGH being the health service unit of the university was the first to be installed in this development, because we became the health provider during the ASEAN Southeast Asian Games in 2019. I think Dr. Batan probably would have mentioned that already. But what's important now is moving forward. So we are in the process now of finalizing the updated memorandum of agreement with the BCDA. Thankfully, they have agreed to extend the use of the land by PGH to 50 years, renewable by 25. So a total of 75 years. That's a possibility for us to be using it. Wala na, siguro nakalimutan na tayo ng mga tao noon pag dumating na yung time na yon. But what's important is we can make long-range plans, and true enough, with the support of the university, of course, with the initiatives of our Department of Family and Community Medicine, we are now in the first step, which is in line with the universal healthcare activities of the Philippine General Hospital. We start with the primary care center. And I'd like to thank, of course, Dr. Robbie Reyes for agreeing to be the point person, our advanced team from that area, who has facilitated, together with our other alumni, facilitated meetings with the governor and the mayor, so that we will be part of the LGU services, which now allows us to fulfill our mandate as a service hospital. So given the opportunities that are very near, in the future, going to happen soon, I think, we have now tracked a program that will allow us to be the healthcare provider of the government offices that will be built around there, to be the center of sports and wellness, which will be a major activity of the government, knowing that the National Sports Academy has been built there and is already actually start running. The state-of-the-art, world-class track and field oval and the water arena. These are all the magnets that will bring in international sports federations to our country, and we will be happy, of course, and proud to be the sports health provider there. But being UP, we do not stop at the polyclinic or a primary care center. We are planning to progress eventually to a 200-bed hospital in the 2.6 hectares that we are given there, which will, of course, as our contract with BCDA has stipulated, will be a sports and wellness medical center. But of course, in partnership with the LGU, we will have to function like a general hospital also. And again, in line with the mandate, the academic mandate that we have also, we envision that the hospital will have an area for research, which is going to be probably a facility that we will partner with the various health facilities that the government will put up there, foremost of which will be the Virology Institute of the Philippines. So, so many things in the horizon, but I think the most important thing is that we already have the right people on the ground. And again, I'd like to thank all of them, and again, thank UPTV and Stop COVID for allowing us to share this so that people will have an idea on why we're making so many trips to New Clark City. Thank you very much. I'd like to announce also that we have a donation for a high ace grandia already for this project.
Wow.
because the trip is quite long, and what we have now is quite uncomfortable. So I think we will have especially when the more senior members of our faculty start going there, I think that will be more comfortable. Thank you very much again, Raymond and Agnes. Thank you.
Thank you so much. That was Director Gap Legaspi. Venerable at really very, very active. Kita nyo naman, we're very humble that he's been able to join us despite 3 other parallel activities ongoing at the Philippine General Hospital. We'll dive right into the questions. Do you have any questions at hand, Dr. Agnes?
Yeah. So January, did I get it right, Doc Reyes, Dr. Robbie, that by January, you are going to be a primary hospital, like you have a 30-bed capacity already?
Not yet. By January 2024, we would be a PhilHealth Consulta provider. So this would provide the services that were mentioned dun sa news natin. These are services that are free as long as it's included within the package.
Okay, so primary pa. So if in case there are patients who would be coming, yun nga, yung mga MOA pa, Memorandum of Agreement to nearby hospitals. But when would you decide that PGH should be the hospital of choice already?
Actually, it's also ongoing. So while we have the MOA, we are also already looking into arranging the licensing requirements for our radiology, also for pharmacy, and also for laboratory. So it's simultaneously happening, given that we need there's time for the licensing processes. We just have the MOA for now as part of the services that we will be delivering. But once our own services are already functional, we'll be the one providing the services already.
Okay. Doc Raymond.
Thank you, Dr. Robbie. Question next po will be, since it's it's a sports and wellness daw. I think this is the wellness part of the medical center. What is the center's commitment to sustainable and eco-friendly practices? That's the question that I have. So Dr. Robbie and then Dr. Lyndon.
Well, there are several things that we could do here, no? So currently, we have this concept which we're referring to as green hospitals, meaning as much as possible, we try to reduce the wastage that we have within and outside of the hospital in terms of the equipment that we are using, in terms of electricity and the other utilities, which is also in line with the vision of NCC. So whenever we plan for this, we try to look for those green options in terms of providing the services for our patients. So that's part of the plan for this clinic.
Okay. Dr. Lyndon?
I think the new Clark City was already well built as a smart city. So the the drainage are already been thought of. So the wastage would be minimal. But for the athletes, their wellness will be for more on prevention, as Dr. Robbie said. We'll be providing nutrition, psychological, and rehabilitation medicine for those who will be needing preventive medicine for to prevent injuries for these patients.
Okay, very, very important, because that segues to my next question, which is for Director Gap. Sir, the question is, what's the role, well, essentially sabi niya po, ano po yung role na piniplay ng PGH Clark sa kabuuan daw ng development ng New Clark City? Okay. Director Gap.
So, I guess these are the vestiges, the start of our UP health system creation. So the vision is that we'll have a PGH hospital where we can bring forth the triad of our mandate, which is service, training, and research. And service is very well provided by a lot of hospitals already. But being a university hospital, I think we have to start expanding out of our confines here in Manila to bring training and research to areas where it may not be as accessible, and this will be the first outpost for that. So if you imagine our School for Health Sciences in Tarlac City, this will be accessible to them now. If they're doctors if there are students who are going to proceed as nurses, as midwives, and even as doctors. No? So this will be their training hospital as well as the other colleges of medicine around the area. On our part, it also allows us to divert patients away from PGH Manila, because our census shows that at least 50% of our patients are from outside NCR, and around 15%, 10% are from the Luzon area. So imagine if there are ways to coordinate the delivery of PGH care, then that will also decrease the number of ambulances that we get here every day. Just to tell you, we are also thinking of a PGH in Cavite, and talks are already ongoing for that, so that the 30% of the patients who come here from the Calabar zone will also have somewhere to go to, which is also PGH. So we are just carrying the brand in areas where it is more accessible, so that we don't. I think it was in the news that we were 200%, almost 200% over capacity in the ER every day. So that's part of the way to decongest also the PGH in Manila.
Thank you so much, Director Gap. Hindi ko alam mo ba yung PGH Cavite, Dr. Agnes? Okay pala yun, ha?
Grabe, masyadong ang dami. Parang I'm so amazed. Forever director ka na ba, sir? Grabe, ang dami.
Papasok kay Lindon.
Hindi, pero sir, may tanong lang ako. Kasi kanina, Lindon, you kept on mentioning lang about UP athletes, no, the UP Maroons. But I'm sure that this is envisioned to be the go-to center for our Philippine athletes.
I think yun yung long-term plan, especially that they started already the National Academy for Sports there. But as I know, as of the moment, they're still these are still the new athletes. These are not yet our national athletes. These are the new athletes that they will be training to become the next icons in our sports. No? But currently, the PSC has their own arm. But sad to say, I think they're not as well funded as if you compare it to the UP Maroons, where we already streamlined the whole treatment of the UP Maroons. The PSC has not gone towards that objective of providing enough funds for their athletes. Actually, in PGH, we already had some done surgeries on our national athletes because of the consignment in PGH, it's free. So they would rather go to us and get the whole services provided through our charity services and consignment. And then the money that they got from the national, the PSC, they just use for additional treatment or rehab or other medicines that they need.
If I may add, Agnes and Raymond, again, as if fate destined it to be, in 2017 we launched formally the Varsity Wellness Program of UP. That is because we realized we have so many athletes who are injured and yet continue to participate because they don't have the 600,000 to have their anterior cruciate ligament treated in private hospitals. No? So thanks to the efforts of Dr. Batan and the whole sports medicine division of the Department of Orthopedics, we were able to gather enough manpower and resources to operate on our athletes for free. So the UP system pays for some of them. Of course, PhilHealth will pay for it and PGH some of it. And the thing is, Dr. Batan and his team gives everything for free. I mean, the services. No? So we probably will carry this over to the Sports and Wellness Medical Center as a model that we can use for all government-sponsored athletes. So the vision for that will just, as I said, will get out of the walls of PGH here in Manila.
Okay, thank you so much. Do you have any final questions, Dr. Agnes? Or
Wala na, no more.
you're okay?
You're okay.
Sige po. So we'll go to our two questions. Can we have them on the screen? Slido po tsaka sa Zoom. And those two questions. First question will be for Dr. Lindon. The second question is for Dr. Robbie. Can we have yun? Okay. First question. What is the most common sports injury, Dr. Lindon?
Tama ang survey. Ankle sprain would be the most
Ankle
common.
sprain. Okay, sir. So 80% of those who answered in the Zoom got it correctly. Interestingly, 17% chose ligamental tear po. Very, very interesting lang. For our second question reads, what services are included in primary care? Dr. Robbie?
So for this one, this is quite a tricky question, no? So there's a need for us to really specify and also provide qualifiers for our choices. But for this one, actually, it's all of the above. So all of these are still a part of primary care. So that is how extensive primary care is.
Okay, thank you so much, Dr. Robbie. So we'll have lang po, we'll dive right into our evaluation poll. Can we have them on the screen right now? And while I'm reading the 5 questions for our evaluation poll, we'll ask Dr. Robbie, Dr. Lindon, and Director Gap to think of their parting words or farewell messages po to our audience. So I'll read them. Number 1, panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. We will not be closing the panel discussion poll or evaluation poll until the end of the webinar po. No, we are not sending out separate one. Ito na po yun. So we encourage everyone to type in, enter in your comments and your answers po dito as we move on to the parting messages from our speakers. Dr. Agnes.
Yeah, so let's call on perhaps our first speaker, Dr. Robbie, for your parting words.
Yes. So when we were envisioning the PGH Clark, we tried to dream big, and dream big we did. And then whenever we feel those parts we're in, we feel that we won't be able to do it, we go back to our inventors and innovators. A lot of them also dream big. Some of them were even called crazy, but they knew that there was something that had to be done. So even if it was difficult, even if it seemed impossible, they still pushed with it. So this is something that we also want to carry on with PGH Clark, not just for us, but also to collaborate with the other people. Because if we're working with the rest of the community and putting together our collective vision and also putting our heart into it, we would be able to achieve our vision for PGH Clark.
Okay, Lyndon, can we hear your parting words?
Currently, I think in the last few weeks, the last time we were happy was when the basketball team won the gold in Asiad. And that's how sports affects us. And because now that we are trying to be a primary sports health provider in the Southeast Asian region, this would be at the start. And I'd like to thank everybody in who is behind this thrust, including Dr. Legaspi, the UP system, the national government. And I hope magtuloy-tuloy ito for the benefit of all our heroes in the sports community.
Okay, thank you, Lyndon. And of course, Director Gap, for your parting words.
Yeah, first, I'd like to thank, of course, Dr. Robbie and Dr. Lyndon for staying the course, so to speak, in seeing this through, and to Raymond and Agnes and Dr. Stella for allowing us to share this so that people will have an idea on what's in store for the UP and PGH. So all of these efforts are in consonant with our objective to reach out of our comfort zone here in PGH and participate in the national development of healthcare. It's not limited to cardiac surgery or to neurosurgery or to gynecologic oncology. It's really all across all the needs of our countrymen. And primary care and sports are really some of the two areas that we probably have a very, very big opportunity and huge potential to advance in as a hospital. Since we are going to do something for the community, we just thought that it would be best to bring it to the community rather than do it here in the Philippine General Hospital in Manila. Thus, this effort to bring out this program to where it probably will be most felt. Not to solve the problems of the country, but to be a template, to be a template for us to maybe in the future benchmark the next primary care sports wellness center that will be built for our patients. So of course, it's very challenging to do this, but I guess if you have people like those in the family medicine department and in the orthopedics department, it will not be too difficult to pursue. So thank you very much again for this opportunity to share this with you. Thank you.
Thank you. Thank you so much, Director Gab Legaspi, and thank you for joining us in this webinar. So we'll close our webinar. Of course, we always close it with one of my mentors from the Department of Obstetrics and Gynecology na kinuha ni Director Gap for his office. She is now the head of the Office of Expanded Education and Training. For her synthesis and closing remarks, Dr. Stella Jose.
Good afternoon, everyone. Thank you for watching our webinar. It has been a very interesting webinar for me also. So the developments in PGH, we now have the PGH New Clark City Sports and Wellness Medical Center, and it is envisioned to be a polyclinic. And the timeline is by January 2024, it will become a primary health facility, and it will be PhilHealth accredited. But for now, we are still making the moves for MOA and pharmacy and license for the pharmacy and the radiology section. It is envisioned to be in phase 2 to be a 30-bed hospital, and there will be the sports and wellness medical center and infirmary to add to their place. No? So and in phase 3, it's envisioned to be a 200-bed hospital. It will become a level 3 multi-special hospital. So abangan natin to, no? I think it will happen. I'm sure it will happen. The director Gap there, and he will push all the buttons for this to happen. Okay, so, and we have Dr. Lyndon Bathan. You know, it's very impressive to see Lyndon's presentation. And I was really touched with what he said. No, by the way, he is the head of the sports medicine division of the Department of Orthopedic Medicine. And ang kanyang key ay service to the athletes. That's a very big thing. You know, it's very hard to be an athlete because they're very prone to injury. And sabi nga niya, they were given very good facilities for sports injury. They have a warm OR, which actually we do not have here, I think, in PGH. But they have a warm OR, and they have the latest arthroscopy equipment. You know, that's
Ma'am,
really...
sa PGH po yun.
Sa PGH ba yun? Oh, sige. Okay. And then the endoscopic ang kanilang procedure. So they are fully supported by the dean and the director of the hospital. And they also support the athletes, the UAA athletes, and bukod sa preventive medicine, they also have the rehab medicine component. Now, this facility is also envisioned to be part of the research agenda of the Philippine General Hospital. So, magkakaroon ng data collection doon for us so that we can improve our systems. And during the time of President Danny Concepcion, an IRR, implementing rules and regulation, was formulated and created so that UP athletes will be treated for free for their injuries through the help of the rehab medicine department and also the of Camp College of Allied Medical Professions. Okay, so that's a very good move, no? You know, the the instruments that they use at saka yung kanilang mga ginagamit na mga nails and all that are very, very expensive. And for that to be given for free, it's a really big thing, no? Big move and support for the athletes. From Dr. Cap, he mentioned that in the long term, the plan is a 300-bed hospital with a sports and wellness center. And for the academic part, the vision is the hospital will be an area for research and will partner with other hospitals. So what you said, in clincher niya, what is important is we have the right people on the ground. So that's all for my synthesis, and back to you, Agnes.
Thank you, Ma'am Stella. Thank you for capturing the essence of the webinar with your excellent synthesis and closing remarks. And next week, we will have another exciting topic for all of you. So please do not miss it and join us again next week. In the meantime,
thank you so much. Thank you so much, Dr. Stella. I would also like to take this opportunity to thank Dr. Robbie Reyes, Dr. Lyndon Batan, of course, our director po, no, Director Gap Legaspi, for really pushing and all the work behind the scenes to make sure that ito pong UPPGH Sports and Wellness Medical Center will come to fruition. But before we conclude our program, All Stop COVID webinars are archived for viewing at the TV UP YouTube channel. So you'll just need to obviously open up your YouTube app or go to www.youtube.com/TVUPPH for you to be able to watch all of our webinars po, no? We could also watch it in the playback doon po at saka sa ating TVUP Signal TV channel 101. We also have this what we call maikli po selected presentations that we feature in its entirety, lovingly called shorts. These are short YouTube videos. You can also see them at youtube.com/TVUPPH. Obviously, I think you're seeing on the screen yung pong to date, at least 74% of our attendees participated dito po sa ating evaluation poll, and at least 94%, napakataas po ng ating attendees strongly agree with each of the statements. Really a testament to the webinar speakers that we have, the quality, and of course really hoping for the better in terms of the UP PGH Sports and Wellness Medical Center. So this formally closes our webinar for the week. Magkita-kita po tayo ulit next Friday from 12 noon to 2 p.m. It's a date.
It's a date, and thank you so much for joining us. Together we can stop COVID deaths.
So keep safe, keep healthy, and see you online.